Is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is Friday, July 24th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. We have several presenters today. First, we'll hear from Bernie Simons, the Deputy Secretary for DDA. Also with us is Rhonda Workman, Director of Federal Programs, and Shawn Kros, the Executive Director for the ARC of Northern Chesapeake. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There's one option for listening to the webinar, and that's by computer. There are two handouts for the webinar, and you can find them in the handout section in the panel to your right, and they can also be emailed. We will be recording the webinar, and we will be posting that on the YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and thank you. Can you hear me okay, Donna?
Yes.
Okay, thank you. Well, I want to thank everybody who is participating today. It looks like we get about 365 people or so, and I think that that's a good turnout. And so obviously we want to talk about where we are, and again, our continued support for doing this webcast. We obviously went to every other week because we were doing them weekly. And today we have Shawn Kros, as Donna just said, who's the Executive Director of the ARC Northern Chesapeake, who's going to talk about what their agency is doing about reopening and supporting people, etc. Again, I want to stress that we are in no rush in DDA to reopen. We want to make sure that we can go back and do lessons learned on where we are with this pandemic, and obviously some of the changes in the way we were doing business with like a lot of remote technology, etc., that may become a new norm. So again, in looking at our opening remarks, our highest priority is health and safety of individuals. And again, I want to thank everybody for their continued support. Donna, if you go to the next slide. Yeah, thank you. And where we are with working with everybody, and again, people giving us good feedback about what we're doing in working with our individuals. Next slide. And so I want to make sure everybody is aware that there is the Provider Relief Fund that CMS has been talking about, and that there is an upcoming webinar. And it's July 27th, and that's on this slide, and there's a link on how to register for the webinar, and it's all about the application. This money does not funnel through the state. It goes directly to the providers and with your application, and obviously it's for Medicaid and CHIP programs who have not received any payment from the provider relief general funds, etc. So we need to go back and make sure that everybody in our DDA community is well aware of this and how to access the webinar. Again, coming up on the 27th, and then obviously it's the applications will be due August 3rd, but I would suggest that if people may want to just take a look at what they're doing, and there might be some helpful hints on that webinar. Next slide. So again, the Provider Relief Fund, how to apply. Here's the link directly, so the first link was for the webinar about how to complete the application. Here's the link that we have for the application itself. And so again, we want to be as helpful as we can in DDA to make sure that everybody is aware of opportunities to receive additional funding through the federal government, and where we are in moving forward and assisting everybody and trying to keep providers as whole as we can. So the NORI, which is our next slide, basically is what I talked about before. We did send out through constant contact some information. So let me just recap quickly. So some of the money that came in went to the housing and community development, and it was $40 million. And they put out a notice, and we had worked with housing and the Department of Disabilities and the Behavioral Health Administration to do a carve out that would be earmarked specifically for the DDA and the BHA providers. And so we initially were told that that was going to go out on their website, they being Housing and Community Development, possibly on the 22nd. Subsequent to that, it was then going to move to the 29th, and as of now, it will be up by the 5th of August. It is limited to the providers in BHA and DDA. So if you go into the application that opened this past Wednesday, there won't be anything about BHA and DDA format. And so I'm not saying you shouldn't do that, but I am encouraging everybody to take a look at, since we did have this set aside money of this $10 million, to make sure that you start taking a look at that. And it basically say, you know, what is the name of your agency? What's your overall license number for your agency, et cetera, and additional questions. And so then they will be reviewed over probably the next 2 weeks after that. And then I would anticipate them starting to do processing the invoices, or whatever we want to call it, that's being submitted. So again, you know, let's be aware. If the date changes and it's released prior to the 5th, we'll send out through constant contact and put on our website if there's a new date. Again, I want to make sure that everybody's well aware of these opportunities and how we are moving forward. So next slide, I want to talk about the provider survey that we did. We actually did a pilot, as I mentioned a few weeks ago, and had providers and give us feedback about, you know, were the questions accurate? Should there be additional questions? There was some great feedback, because one of the questions that we asked was, you know, did you have to either lay off or furlough staff? And then there was a recommendation that came in and said, yeah, we did, but we went out and we purchased as an agency some laptops so that our staff could come back to work and work remotely with the people that we were providing supports to. So obviously there was some good lessons learned about how we are working with our folks in our agencies. And so you see you'll see on the next slide where there is, we had 84 agencies respond, and which I think is a pretty good response rate. And you'll see there's a breakout of the total number of agencies that responded by the type of services that they provide. And then you will see of that, in the other column, the total number of participants receiving services represented in the survey. So again, you know, of the ones that responded, 32% to residential services, and of that, 33% of the population were in residential services. And obviously it's for a facility, meaningful day, community-based integration and supports. And so I think it was a good response that we got. It obviously was in a short period of time, and people are very, very busy trying to make sure that everybody's safe and healthy, etc. So again, with the provider survey, and going to the next slide, obviously there's been an impact on the workforce with DSP, and as we identified, about 63% of DSP separations, because that was one of the questions, had to do between March and May were related to COVID. Now, when we say separations, that could be voluntary separations or involuntary. And so if anybody is interested, we can make that data available, but obviously we can see it has had an impact on the number of, on our workforce as related to shifts closing, workforce separations, taking a look at what we're doing and looking at new hirings. On the next slide, you'll see this is a breakout of the survey. And this slide shows from March through May. And then on the right-hand side, you'll see where the stack bar is. It basically shows the reasons that people left, whether it be for COVID or non-COVID related. And so I think that this is extremely important for us to take a look at. When we look at this with the total number represented, obviously it's 7,300, and there were 499 or 500 people who left the agency. 28% obviously, therefore, were related to non-COVID related reasons, and 46 were COVID related. And it's important for the 27% staff that we looked at all of the data and the reasons for separation that were given to us. There were a few, obviously, that you can see on this slide that there was no reason that they were given to us. And obviously, I think that that's expected in any time you do a survey, that all the questions aren't going to be answered. If they all weren't answered, we basically many of them were 100% answered. Some were not quite 100%, but it did give us an opportunity when our consultants reviewed all of the data to be able to put together some of these charts and give a look at where we are. So on the next slide, you'll see that, and this is again looking at the survey of where we are, and that the facility-based meaningful day really was the area that was impacted. And obviously we've done this by months, by color code for March, April, and May, and you can see where we are with the facility-based meaningful day being about 43% in where we are and what that looked like. Again, I think, I think it'd be good for people to take a look at these slides when they're up on our website. And then if there are additional questions, we'll be happy to engage and answer all of those questions as best as we can. And so, again, on the survey, we had about 83% who responded. And again, a lot of the information that we picked up was, I think, important for us to share, because sometimes you just have your agency and you don't know what's going on in other parts of the state or what other people are thinking. And we want to take a look at where we are with remote on day services, et cetera. And I thought it was interesting that of people using remote, over 60% said that they would like to continue to use remote services. And I think that's what I wanted to get to earlier when I mentioned that, I'm not sure when people talk about reopening, like Shawn's going to do in a little bit, of where we are, what does that look like, what is the new normal. People seem to be happy with using remote supports as opposed to going back to a business as usual. So I think we're in, obviously, as I said earlier, no hurry to reopen. I think we need to be very, very careful and very strategic on where we are and what we're doing. So our next slide basically talks about, Donna, can you advance? Donna?
Do you see it? It's
No, you're
Provider
on.
survey
Keep
continued.
going. Next one.
Next one? Okay.
That's it. So obviously, this is a little break out of what I was just discussing about where we are with interest in continuing virtual. Again, I think, as I mentioned about when we looked at the survey, that some agencies decided they were going to buy computers, and so that they could do remote and virtual supports, etc., which again enable them to meet the person-centered planning that people who are in their agency, as well as bring their staff back so that they could remain employed. So again, that's what this slide basically does. And again, I think it's important for us to note that this is a sea change. I think that knowing that there have been studies done by the President's Commission as well as ANCOR and other entities that keep talking about the crisis and direct support professional shortages, that we really need to think differently. I think this gave us an opportunity to use technology to experience. Unfortunately, people have passed away from the COVID-19, but I think that from lessons learned that we have had within our agencies and our DDA community, that we may want to think about how to do business much, much differently than we have in the past. We had the opportunities to do the Appendix K with Medicaid, to submit and get approval from CMS, and now I think we need to go back and take a look at where we are and what pieces of Appendix K need to remain in place. So again, I want to basically mention that on this next slide, our goal is to what we're looking at for remote in our current services, and then we can change any policies to get into what does that look like for the future, and what do we need to do, and how to remote work, and how to better understand, and what do we need to do with our waivers, and what waiver amendments we need to do to strengthen more about obviously doing business much differently than what we've done in the past. And again, I think learning from everybody's collective experience, which I really appreciate the feedback that we've been getting about what we've learned and what the new normal would look like. And so I want to talk about framework for reopening. Next slide, Donna. And so where are we with thinking about for reopening? We've had obviously the committees that we've had with the regional offices and the staff and the providers in each region. Excuse me. We know that the regions are in much different places. If you look at the general population, 4 who are testing positive for COVID, the West region is about 1%, the East region is 5%, and then obviously the higher numbers are around the Baltimore County or our central region and our southern region. And so obviously we've had these reopening committees. We've taken everything, we've posted the notes that the regions have put together with the really good discussion and thoughts and deliberations that have been basically going on for at least 2 or 3 meetings in each region. Based upon that, we have created a reopening consideration framework. And again, it's consideration. I'm really concerned that people we're in no rush, and that people have the opportunity to think and consider all aspects of where they are with people that they're providing supports to, whether they have them residentially, as well as some type of day, or people are living at home with family and have some type of day employment, etc. And so, again, we are looking at all of these documents. We have put something together. We actually have these documents out to be reviewed by people who are epidemiologists, environmental physicians, etc., so that we have some type of people who are in the public health field who are well aware of how to deal with pandemics. Obviously, this isn't the first one we've had with COVID. It's serious, but we had the H1N1, and we have flu seasons, etc. And to make sure that we start taking a look at this. So we do have this out to the people who are staff and MDs in the public health administration within our Department of Health. And so you'll see on the next slide, looking at framework to reopen, obviously there are some areas that we wanted to take a look at. And so the State DD Directors Association basically has developed as a reference, and obviously the link is here for day and employment services, and it focuses on 3 different areas. It focuses on what does the state system's level of consideration look like. The second level is provider level considerations, and then the third element is individual and family level considerations. And so, as we continue to engage with the Center for CDC Control and our public health experts and the DD Coalition, we will issue this. There is also another document that we'll be issuing, and it's from the American Academy on Dentistry and Physicians, I believe it's called. It's a good document. I reviewed it the other day, and we'll make sure that that link is on our website as we continue to move forward and have people make decisions and see where we are with any type of cautious reopening. On our next slide, I want to just do the updates as we do all of the time with, so what does it look like in our regions? And I can tell you as of yesterday, the 23rd, in the South region, there was 220 individuals and supports who tested positive. 56 were negative, 1 pending, and we had 18 individuals and supports who passed away. In the East region, there were 33 who tested positive, 54 negative, 5 pending, and no one passed. In the Central region, there is 147 people who tested positive, 268 negative, 18 are pending, and 15 people have passed away. And in the West region, there is 23 tested positive, 130 tested negative, and 2 pending results, and 2 people had passed away. DSPs who have tested positive to date in the South region is 154, with 4 staff who had passed away. West region 30, East region 63, the Central region 173, and 1 person who passed away. So if you look at on the next slide with our DDA tracking, you'll see where we are and what these numbers look like. Obviously, we've been using the pie chart with 17,764. So 90% of the people in service, 97% of the people in services, of which only 3% have tested positive. And I think that that's due to the good work that everybody's doing in keeping people safe, washing hands, social distancing, etc. And then on the right-hand side, you will see what the weekly numbers look like for all 4 regions that we have and what those numbers are. On the next slide, this is our statewide tracking for the number of people who have tested positive and the number of people who have passed away. Obviously, the chart on the left shows from June 25th to July, there was an increase of one individual who passed away, 34 to 35, of the 423 that tested positive for COVID. And so the pie chart on the right shows the number of folks who have passed away, which is 7% of the 458 who tested positive. And since our last report, there was one individual who has passed away. With that, I'll end my presentation, and now I'm going to turn this over to Shawn Kros, the Executive Director of the ARC of Northern Chesapeake. Welcome, Shawn.
Thanks, Bernie. Can everybody hear me?
Yes.
Great. Well, good afternoon, everyone. This presentation today is, go ahead and go on to the next slide, Donna, is meant to just tell you how we have been impacted by COVID and decisions we've made along the way, just as you all have made decisions that work for your organizations and those you support. The ARC NCR provides a range of supports to people from birth to the end of life across the arc of a person's life, and our service area is Harford and Cecil County. So I'm going to tell you where we were prior to March 13th, where we were a few weeks later, and where we are now. Also the decisions we've made and that continue to make, and the tools and resources we have used to make these decisions. There have been many unknowns, and there continue to be many unknowns throughout this time. And when asked questions, oftentimes the answer is, I don't know, or that was what we knew at the time, or now this is what we know. A lot of uncertainty during this time, and from what we are all hearing, this uncertainty will remain for quite some time. So our team decided that this was the perfect time to reset, reimagine, and adopt this tagline, to challenge us on how we want our supports to look on the other side of this pandemic. And it's through this lens that we are making decisions on how we begin to reopen. Since we do not plan to go back to the way we've always done things, this in itself is challenging because of the many stressors that are occurring, and at the same time, it's also motivating to implement changes that will benefit those we support during and after this pandemic. Next slide, please. So on this slide, you can see a visual of COVID's impact on the supports that we are able to provide, as well as the organizational impact. So we shut down most support in Meaningful Day on March 13th, Friday, March 13th. That week, the world changed for most of us. 93 people we support were working in community integrated employment, and we provided 37 people transportation to those jobs. During the pandemic, 32 people kept those jobs, and we provided 8 people transportation during that time, and still are providing transportation to 8 people. At this time, we have over 50, almost 60 people back to work, and they are getting to work without our transportation support. So just to kind of give you perspective, prior to March 13th, we averaged about 33,000 miles per month in our transportation fleet, and now it's under 3,000 a month. We had a community-based day program that used the building as a hub, and most days about 300 people would be in and out of our building. It was very hustling and bustling all throughout the day for their activities, employment, searching for employment, different community day activities, and that all ended very abruptly and people stayed home. Now this week, we started supporting about 30 people in small groups in their community for short periods of time. And in addition, we average about 30 people per day using the virtual supports. Our residential program supported 96 people in 31 homes. Some went to live with family, and our number right now is 94, since some have returned back to their home. Personal supports shut down, with the exception of the 6 people that have essential long-term support needs. 2 people did during some of this time go back and live with their family and have since returned home. Our family support team, though, that they provide supports to over 300 families, they never slowed down. And in fact, they became busier with calls and referrals. The only exception, though, is that our inclusive Camp Spark was canceled for the summer. Team members, we had 367 team members as of March, and we also had 42 supported team members, people who worked on different contracts throughout the county. Our current team member count is 310. 26 people were furloughed. Most of them were in personal supports, and they weren't able to pick up any shifts in our residential. 18 have been on some type of leave, and all of our supported team members on contracts have been furloughed. 2 are going to be coming back next week. There have been 9 official layoffs, most of them happening in our transportation department and our summer camp personnel. Our administrative building closed by the end of March, and most people went remote, and now we are using Microsoft Teams as our way to communicate. We began phase 2 with about 25% of our administrative personnel back in the office about a month ago, but just this week we went back to phase 1 because we're seeing an uptick in positive cases. We've had 4 people we support test positive. We have 9 pending right now. We have 12 team members who have tested positive, with over 45 pending tests right now. We've definitely seen an uptick in cases, so therefore our residential supports are also back in phase 1 with no visitation or community activity policy for at least 2 weeks. Next slide. So our internal case management team has really been our lifeline to those we support in Meaningful Day. All of our day team members were sent to our residential program. Also, we had clinical team members, some transportation team members that also went to work in the homes. We began this thing called Spirit Week very early on, and we continue it to this day. It's a week-long activity list with all kinds of resources delivered to each home weekly. We began our virtual supports in mid-May with just our residential homes. This allowed us to work out a few things before we were able to roll it out to those who lived with their family. This has been a hit with many, and we are seeing a bit of a decline over the last few weeks. Is it summer? Is, what's going on there? We'll keep an eye on that. This team has worked so many hours helping people we support and their families just get set up and to learn to use technology. There are a few people that do not have internet or devices. Or virtual supports. It's just not appropriate for what they need. During this time, we developed a COVID response toolkit that looks at each person and each home and is full of what-if plans specific to the person and where they live. We developed a phase plan for residential that includes topics such as visitation, activities approved. I mean, everything's in there, all based on where our community is. Also a building plan that has phases. We are supporting people to get to work utilizing someone other than ARC transportation. And making our decisions about how to support those with Meaningful Day supports, we used the lens of needing people to be physically distanced and socially connected. We worked with people to understand the need for mask wearing the correct way and to understand the importance of hand washing. We worked with families to understand the risk of underlying health conditions and also where they were in regards to feeling safe. We adopted informed decision making. We always use it. It's a NADSP tool. We've been using it for years, but we brought it back to use it specifically and making these type of decisions for families and team members. So I'm going to give you an example. One woman we support who lives with her family, and she works for a food distribution center. She's an essential employee, but she met many of the high risk factors: age, some health conditions, struggled understanding social distancing. So the team met, they continued training, and that is when we changed the term to physical distancing instead of social distancing. At the end of the day, her family said she wanted to work, she understood the risks, so therefore she continued to work. She's still working there and absolutely understands physical distancing with prompts at times, but who of us doesn't need those prompts sometimes? Throughout all these discussions, we created a matrix, a family individual need, ability to physically distance, ability to wear a mask, underlying health conditions, person's willingness to go out. We have supported some families during this time with one-to-one in their home due to extreme need. We're also doing more one-to-one supports for those who live with their family and evaluating the need of each person in this family. And then there is an attachment that we use frequently. It's a scale of 1 to 10 and helping people and team members and families decide what is safe to do. This week, we started our first community small group from that matrix list that I just described. And there were about 30 people who were identified that met the least risk criteria. And we are using our DSP3s. We adopted the NADSP badge program a little over a year ago, and we have 5 DSP3s that are with us. And so we are using 2 of them to provide all of our community supports. This group has spent a lot of planning time to learn to use the person's community in developing natural supports. They're using that Friends tool from the Delaware Leadership Institute to navigate their community. So far, this has been good this week. People were really excited to see each other. We're learning that a few needed a little more mass training, but being with others is helpful for them to understand the norm. Also, one person just said he wasn't coming back because he couldn't bring food and we weren't going out to eat. So we also identified outside of those 30 people who needed mask or physical distance training, and we will be providing one-to-one coaching in their yard with the goal of getting them in a small community group as soon as possible. The resources we found most useful was honestly you, all of you, through webinars from Max, from DDA, working on the CMRO work group, Leadership Institute, phone calls, reading, brainstorming, learning what steps all of us were taking was extremely helpful. Also during this time, Harford County established our own group to work through issues and support one another. We have about 6 providers. All Harford County people are welcome. Service coordination also is there. And in the beginning, we also had Harford County government on these calls. We learned from families and those we support. Some families are not seeing this as dangerous, and others are saying their loved ones will never go out until a vaccine is available, and then all in between. I get that because, I've probably been on all ends of this thinking throughout this time, but I also get to make my own decisions, right? I received a text from a young woman during this time that we support in her home. She was wanting her boyfriend to come over and visit. She wanted it to be outside. I'm going to read it to you. It says, "Hi, please can he come over? You all let the staff come and go, and that's not fair. I just want to see him for just 2 hours one time a month. Please, it's killing my relationship. The staff goes to see their families, and it's not a high risk for him to see me. It makes no sense that he can't come see me. I just want him to come and hold me. Look, I don't understand your logic, but there is one fact to all of this. Your staff come and go 7 days a week and are with their families, but my boyfriend can't come over 1 day a month for 2 hours. My staff has more chance of getting us sick than him. See why I say your logic makes no sense whatsoever?" Well, it's complicated, right? We're all trying to get through this. Next slide. So first off, I want to say that a major win was to see the dedicated team members who, stepped up during this whole time, and the resiliency of those we support. I just had a mom tell me this week that seeing how well her daughter was doing during this time, that she could actually die in peace now, knowing that she was a strong woman who could weather a pandemic. It's true. We've seen the strength of the team members and those we support. And then when putting this together, the wins and the struggles, I realized that many of our wins are also still our struggles. As we're slowly reopening Meaningful Day, we've have very few team members to reach out to. Many of them are working residential. We've continued to hire during this time, and so we're bringing on new team members during this time virtually. Also, as we reopen, we, with not going back to using our building as a hub, is a win, but it's also has many major logistical challenges since we are, considered a rural area, not a lot is open. But right now, the Appendix K allows us to have this flexibility and also be able to financially afford this level of support. So these small steps are going to help us learn, as we go into the future. We've always been known for the employment and the transportation supports that we provide. And from the earlier numbers, you can see that people are returning to work, which is great. And we are assisting them in finding transportation. But we know that this is going to be something that people we support and their families will want to go back to once we get through this. Many of us are dealing with crisis. We're used to dealing with crisis and getting through it. A problem happens, you solve the problem, you get through it. Well, this pandemic is different just because of the gray that we're all in and will be in for some time. Another win is our residential and Meaningful Day team members are one team, and this has been a tremendous win. We literally couldn't have done this without all the support and the hard work and dedication from team members, families, board, those we support, and then, like I said, all of us here on the call. We're in this together. This statement is going to be, it's real and it's necessary to get through. The financial, physical, and mental health struggles are real as we navigate this. In many cases, families need us to do more than virtual or shortened community services. Some families need the day. They need the day covered, but we're taking it one person, one family at a time. We've also had more DSP certifications, the badge program, that have been done during this time because people are taking that opportunity. So right now we have 18, with 5 of them being DSP3s. When we look at the over 80 team members who are enrolled, we have 100% retention with that. And then to just end, communication. We've had some major wins with communication. I have communicated with more team members over this last 4 months, probably than I have over the last 2 years. One-on-ones, team using the team, Microsoft Teams, but also we continue to struggle with communication, just trying to keep up with it and get it out to families, people we support, and all of our team members. Next slide. So I thank you for listening to me today, and I look forward to hearing from all of you with your ideas, your resources, and continued support during these days as we're all resetting and reimagining. I know we are all here to support those with disabilities to live, work, and thrive in the community. Never did I think that it would include keeping this mission alive during a pandemic and how that is being challenged in ways that we have never seen. When we work on fixing the problems, because there are many, I ask that you help me during my dark moments to remember that this is also a time of opportunity, like never before. Thank you for giving me the opportunity to speak.
Oh, thank you, Shawn. I think that was extremely thoughtful presentation, sharing your perspective, all of the elements that you've done within your agency and your community. We'll continue to assess and adjust processes as we see options for moving forward and take recommendations. I think some of the things that Shawn just talked about and lessons learned from Appendix K, as I mentioned earlier, that we should be able to start having those discussions about, so what will it look like in the future? What did we learn from Appendix K with doing supports for people in a different way? I want to thank everybody for their patience and dedication. I do want to go back, and as I mentioned earlier, there was another document, and it's from the about reopening. I mentioned NASD, the State DD Directors Association, but this other one is the American Academy of Developmental Medicine and Dentistry. We will get that on our website, and it's basically for supporting people with IDD through the COVID pandemic. And so I don't know if any of you basically had the opportunity to see that. I did receive it in the email. Actually, there's one of our local providers who's one of the authors in this publication, and they've been around for a while. They're a top-notch academy. So with that, I think we'll stop here and see if there is any questions, and if Rhonda or Donna, if you're doing the chat box or whatever we're doing. Thank you.
Thank you, Bernie. Donna, can you hear me okay?
Yeah, you sound great.
Okay, great. So first, Shawn, we're getting some appreciation and thanks for your information and presentation. And there are a few questions curious about the status of the young woman who would like her boyfriend to visit. So there's some suggestions, like maybe window visits, but also just kind of curious about, was she able to see her boyfriend?
So yeah, interesting update on that. So that was pretty early into the pandemic, and she has visited him. They were doing virtual because she, has a smartphone. He has a smartphone, so they were doing virtual for a while, but that wasn't enough. So we kind of talked through what the risks were. And honestly, about 3 weeks ago, they had time together, extended time together. So But right now we went back this week to no visitation or no community outings.
Thank you for sharing that. There's also a question, it says, what is an example of a Spirit Week package?
So we have a calendar, and every day, like, there will be different activities, different websites to visit, maybe crafts, cooking, themes for the week. Some days it ends in a pizza party on Friday with a movie night. And it tries to tie in with our virtual, but it doesn't necessarily have to. But it gives just every day of the week, there is very specific activities that people can get engaged in. It can be like arts and crafts, it can be science experiments, a very wide range of activities that our team members have put together for our residential houses.
Great, and there's additional question related to one of the slides. It says, what is the difference between team members and family support services?
So that slide, I wanted to basically, so our family support services, they provide unpaid services and unpaid supports to families all across Harford and Cecil County, and so that's just the number of families, and that graph needed to go on that side because of the numbers. And then team members are the actual team members.
Great, thank you. There were a couple of comments that when Bernie was presenting on the data related to positive cases, that the slides were blank. We also saw that on our screen. However, if you download the attachment, the slides are showing. So I'm not too sure what happened in terms of the view of it, but our view showed the charts, and in the PDF in the handout section, the charts are there. So please feel free to download them, and you can see the charts that Bernie was referring to. There was a question related to the new provider relief funds as to whether or not they're available to people who self-direct. Bernie, would you like to answer, or would you like me to?
You can answer that, Rhonda.
Great. So for the provider relief funds, it's available to Medicaid providers, so a Medicaid number would be required. It's our understanding that for people who are self-directing, the funds, if they were requested, would need to be requested from the Fiscal Management Service Agency, because they're the ones with the Medicaid number that is billing those services. And so that would be action that would need to be taken by the Fiscal Management Service agencies. Another question comment says that considering virtual remote is now an approved service delivery model under Appendix K, and that this method is being considered to continue in the future, are there efforts underway to reconsider the need for CPR first aid certification when services are provided remotely? This will increase opportunities to locate staff under both self-directed services and traditional methods. So related to that, I think that's a great suggestion for us to look at. And as Bernie said, we're utilizing the experiences of our providers and participants self-directing and family members to look at, the new opportunities that are coming out from Appendix K that we could incorporate into our programs going forward. And so that's something definitely we could look at in terms of the scope of the services and when CPR and first aid would be required. There was a question, Shawn, it said, what alternative transportation did clients use to get to work?
So we have something in Harford County called EPOC. I'm not sure if that's statewide. So EPOC has been good. Some people are using Uber, and also Family Friends Natural Support. So just a wide range. Oh, and Link is back open in Harford County.
Thank you. There's a comment and question related to the community settings rule. It's noted that CMS has delayed the community settings final rule implementation another year to March 17, 2023, mostly due to COVID-19. And the question was, how will this delay impact DDA's transformation plan? thanking for any assistance. So related to the community settings rule, we continue to work with our providers as they are looking at business models and transitioning. We have heard some great presentations in terms of changes in service delivery from providers in different areas of our state, to include providers that are considering not reopening their day programs because of the success with the remote supports and community-based options they've been doing. So during this time, we're going to continue to support our providers with their transformation and looking to achieve that with the previous time frame, and make adjustments as we need to support our providers if additional time is needed. Let me see some additional ones. There's a question: if a provider wants to conduct 3 or more hours of virtual day supports per day, utilizing residential staff, and bill DDA for these 3 hours, how does this affect the residential provider who is paying this staff to provide COVID-19 live-in supports and is receiving shared add-on services hours? So I think from my understanding of your question, as you know, under Appendix K, we've provided additional daytime supports for residential services because individuals are remaining in their homes. And if you're providing the 3 hours of supports during the day under your residential services, then you would bill as you normally do for residential services. If this person is in your day program and you're providing virtual supports during the day, then you would be able to bill under the day. The next question relates to if there's any updates to additional provider retainer payments. Bernie, did you want to comment, or would you like me to comment?
No, go ahead.
Okay. So in terms of retainer payments, during our last webinar, we shared information about new details and FAQs from CMS. We are going to be meeting with the DDA Coalition on Monday and further discussing some of the options related to retainer payments. As you may recall, if we offer multiple rounds, there will need to be the inclusion of additional what CMS calls guardrails. So some requirements related to reporting, attestations and such. And so we are going to be discussing that Monday with the coalition to get input so that we can then move forward with a decision. Next question: are there virtual programming models that can be viewed that have been successful in providing services? Shawn, do you have any thoughts related to that question in terms of virtual programming or some of the virtual supports that you've been providing?
Can you repeat that question? Sorry, Rhonda.
Yes, it says, are there virtual programming models that can be viewed that have been successful to providing services?
So we started out using, because Seek was so gracious and they put their stuff on their website. So that's where we started to build ours. And then if you go to our website, you'll also see some resources we have for virtual. And if you want, I can connect anybody to Swanisha, who is running our virtual supports program and all the resources that they've been using.
Thank you. Another comment in here: great job, Shawn, on the presentation. Good job in all these challenging times. Question: how do you arrive at the transportation reimbursement for each participant?
Is that a question for me? Because so people are using their own using their own money for the most part for transportation, and we supplement if that is a need that the family has.
Great. There's a question about the new provider rates for fiscal year 21. When are they going to be coming out? Unfortunately, Valerie Roddy wasn't able to join us today, but I know that in our last calls, we had talked about that both the cost detail sheet was being updated with the new rates, and they will be posted on the DDA website. Bernie, do you have any other updates from Valerie on that?
Well, I assume what people are talking about is the 4% increase. Can we get a clarification from whoever
Sure.
asked that question?
Yeah, if you could put that in the chat, we can look at that.
Yeah, so if it is the 4%, yeah, it didn't make it in the payment that went out that the providers were paid for, I believe around July 6th. There was some comments and some questions about, well, we're going to wait to the next payment that would not be going out until October, so that the providers would see that 4% at that point in time. The answer is no, we're working on it. Currently recognize that we need to go in and adjust all of those rates in PCIS2, et cetera. So there will be a payment. They're working on it. I cannot give you right at this minute a projected date. I would hope as soon as possible.
And then we're starting to get some questions in related to EVV. There's recognition that the DDA has sent out a survey related to personal supports. We are collecting information about the number of direct support professionals providing personal support so that we can support with training and additional guidance. We are working on procedures and policy information jointly with Medicaid under their Medicaid provider services as they oversee the telephonic system for the electronic visit verification. And we hope to have that out in the next couple weeks, if not sooner. That will include information and guidance related to EVV for CCSs, for our case managers, individuals and families, and providers. And as we said with that survey, we're looking at collecting information so that we can plan for training for staff and providers. Just looking at some of the other questions. There's a question, can residential programs still bill for providing support during the day, and day services only supports 1 hour during the same day? So I would refer you back to our Appendix K and some of our FAQs just to be sure that we're understanding your question and your service model that you're offering. But there is opportunities for day programs or day services to be provided for people who are receiving residential supports. And again, we do require the minimum of an hour of service to be provided in order to bill for the day. There's a comment, it says, love the name Reset Reimagine, because that is what all of us are doing and will continue to do moving forward. Thanks, Shawn, for a great presentation. Question about, will EVV work with virtual supports? That's a great question. Currently, personal supports are being provided virtually under both the pilot program that we're operating and under the Community First Choice program. So the answer is yes, that's currently being used and can work as we move in the future. Question related to whether EVV will still be implemented on January 1st, 2020. We are working with the coalition and different work groups to get some input related to the rollout. The federal requirement is that we must be compliant as of January 1st, and we're looking at strategies in terms of rolling out the information. There's a question related to, do virtual day services require the same in-person ratios? So virtual services by the name alone would be not in a staff ratio component because they're virtual. So we could look at additional information related to your service model and the needs, but services are being provided virtually in different ratios. Will families need the DDA training if they're providing services at home? If so, what training will they need? So related to training, under Appendix K, there is the ability to waive or modify the training that is on our website. So I would refer you back to the Appendix K guidance related to the flexibilities of staffing. And we're 1 minute left, so I'm going to turn it back over to Bernie to close us out.
So let me just say, Rhonda, thank you for handling many of the questions that you fall under your wheelhouse with Appendix K, et cetera. And I want to thank everybody for their thoughtful questions. Shawn, I want to thank you for a good presentation. I think it was informative. I think it obviously was generated some questions, and we'll probably continue to ask other providers around the state to join us on these webinars every other week, so that we can get different perspectives of what the challenges are, and again continue to have this dialogue about what are we going to look like when we move forward with any type of reopening slowly. Obviously, I think, Shawn, as you said, there was some transportation that came back up in your county that wasn't there before. So I think that there's a lot of variables and areas that we need to continue to evaluate and think about and be very, very cautious. Again, I want to thank everybody for being on this webinar today. Be safe, social distance, wash your hands, and have a great and restful weekend. Thank you.